afternoon, and welcome to this online town hall brought to you by Wayne County Executive Warren Evans. For the next hour, we will have a frank discussion on COVID-19 and its impact on the Black community. Our goal is to educate you by separating fact from fiction so that you, your family, and your loved ones might be able to maneuver through this season. My name is Daniel Baxter. I'm the Director of External Affairs for Wayne County. And to help us arrive at our destination, we have a panel of distinguished and accomplished folk. We have the Dean of African American elected officials in the state of Michigan, our very own Wayne County Executive Warren C. Evans, the CEO of Real Time Media, Mr. Hiram Jackson, Wayne County's very own Deputy Health Officer, Ms. Jennifer Floyd, the Senior Pastor of Second Ebenezer Church, Bishop Edgar L. Vann, and last, but certainly not least, the Executive Director of Safe Brave Space, LGBTQ Detroit, Mr. Curtis Lipscomp. As we move forward, we will go straight into the subject matter with panel discussion, later answer some of your questions, and then close with the remarks from each of our panelists. So let's get to it. Mr. Executive, as the elected leader of the most diverse county in the state and one of the most diverse in the nation, and considering the benefits that such diversity brings to this county, can you talk about the effects of COVID-19 on Wayne County from that perspective?
Yeah, I'll try my best, Daniel, and thanks a lot for hosting this, and thank all of the guests that are here and those who are listening. The ultimate goal for me with all of this is that we not only better understand where we are with respect to COVID right now, but where we're going when we start to come out of it, and what challenges many of us are going to have added to the challenges that we currently have. So as the elected county executive of the largest county in Michigan, the one with the largest African-American population in Michigan, and knowing that we're dealing with the most serious pandemic in 100 years, I think two things from what you said, Daniel. One is being the most diverse county, I've always said, is a tremendous asset because if dealt with properly, we get the best worldview from all over the 360 degrees of Wayne County. On the other hand, when it comes to healthcare, employment, and a number of other issues, that very same diversity that we cherish so much philosophically is always the group with the most poverty, with the most healthcare problems, with a number of issues that certainly aren't inherent to minorities themselves, but it is inherent to the way this country has handled healthcare and a number of other issues for people less fortunate. And so it's a blessing to have a diverse county. It is also a curse to have the results of that. And we'll talk about it a little more later, but when we come out of this, the impact on poor people in Detroit and Wayne County is going to be significant. It's going to be significantly higher than it is for those who are not minorities. And we got a real challenge ahead. And the thing I want to impress on everyone is the issue is shame on us if we come out of this and allow the same conditions to go forward, understanding the impact that we've all felt from this. Thanks, Amy.
Thank you. So I want to deal with this from a historical perspective. Bishop Vann, my next question is to you. Historically, African Americans' only source of relief and finding a method to cope has always been the church. Today, the church has been forced to close its doors. And as a consequence, many of those individuals who are seeking help, many of those people who are seeking counsel, they don't have anywhere to turn. So how does the church respond in this time? And how can those who, for whatever reason, are seeking help find it? Can you all hear me?
I can hear you, but it appears that the bishop couldn't.
Okay. So let's go to the next question. And my next question, I pose it to Mr. Lipscomp. Curtis, COVID-19 is known to be a particular threat to those with compromised immune systems and other health issues. What does that mean for the LGBTQ community?
COVID-19 is going to impact many of us in so many different ways. But as a Gen Xer, this is bringing back some horrible memories that I've witnessed in the early days of the HIV epidemic here in the United States. Although it was originally discovered much later as an African disease, first discovered in Africa, when it hit America, it landed in the gay male community. And so at that time, it was a virus that no one knew of. And so we were scrambling, trying to find research and trying to find cures while many people were being infected and, of course, dying very rapidly. So I just want to share with you that these past several weeks have been painful for me personally and people like me who've witnessed it previously. COVID-19 is an additional health crisis that impacts people infected and affected with HIV. The city of Detroit is ground zero for the most infected people of HIV, and that's according to the Michigan Department of Health and Human Services. And so HIV still is a problem. It is our #1 problem in the LGBT community because it still can kill. And it can still kill because there's still a number of people who do not have access to information. And of course, they have very little access to care. There's a number of reasons why I can share with you that. And if I can say just one major thing, the stigma of HIV is still an enormous burden to people impacted with HIV. And so one of the issues that I have in this current age of this new epidemic is coronavirus stigma. I am highly concerned of the impact of the virus is to the African American community and the potential harms that will come of it, like the gay community did experience up until 1996. There was a long period that people did not want to associate or connect with gay and lesbian people from 1981 to 1996, when the first drug therapies emerged to do significant, to delay the significant deaths of people infected with HIV. So I'm alarmed. I'm concerned. This isn't new to us, but we're going to do our best to take care of each other and share the messages that we've learned from the movement to our brothers and sisters who are impacted by the COVID-19 infections.
Thank you, sir. I want to jump right back to Bishop Vann and toss that question back to you. Historically, Black folk has always went to the church whenever they had problems and challenges and to overcome certain issues that impact them on a day-to-day basis. Today, we have a challenge with the fact that the churches are now closed. Where do people go to find help, to find hope, to seek all of the things that are necessary for them to overcome the challenges in their life?
Well, thank you very much. I think that one of the things that's so important is the medium that we're using right now. The technology that we are using is now available to everyone. And so the church has embraced technology in ways in which you would never think that they have, in order to stay connected to people and to reach people every day. I'm working 10, 12 hours a day just from home, reaching people, helping people, organizing our food programs that are even more operable now, sending food to emergency rooms, to funeral homes, etc. The ministry of the church has now gone outside of the building. So that's a good thing, that the church has left the building. And the church is now in a position to not just have church, but to really be the church, to exemplify what we believe in our convictions directly to the people in the community. Many churches have already been doing that. I've been doing that for many years. But now every church has to look at itself and to realize it's not about positions, it's not about titles. It's got to go beyond a song, a sermon, and a shout. It's got to get to the place where we're literally touching people, literally helping people. And if we have to do it virtually, we can still do it.
That's good. Thank you so much. Hiram, you're the businessman. You're the media guy. What do you see as the critical role of the Black press during COVID-19 and informing, educating, and providing that information to the community? Can you share that as being the publisher of the largest Black paper probably in the nation, from the Michigan Chronicle?
Can't hear you.
All right, can you hear me?
Yes.
All right, great. Thanks for the question, Daniel. I see the role of the Black press as what it's always been, since 1827, when John Russwurm and Sam Cornish published Freedom's Journal. Our job is simple. Our job is to make sure that the collective Black voice is being heard, and that the issues being raised in the media are seen primarily through a Black lens. And that's how we've tried to deal with this crisis. I look at COVID-19 and I say to myself, this crisis was tailor-made for devastation in the Black community as we are structured now. Most of us live in urban environments where the population is dense. Many of us depend on buses or mass transit. In Detroit, 35% of the residents don't have cars. And so, I see the Black press's role is to shed light to those kinds of issues and make sure that people understand that not only is this a deadly disease, but the makeup of the disease is kind of tailor-made for those who are kind of at the bottom of our socioeconomic status. So, we publish 24/7 on our digital platforms, and we've been very committed to making sure that COVID stories are at the forefront of everything we do. Resources for small businesses. We try to make sure that the homeless know where they can possibly get opportunities to be fed, making sure that the messages from our leaders, those messages are being amplified. And so we're on the front line, and I can say that about my counterparts in other cities. We also publish the Chicago Defender in Chicago and the Pittsburgh Courier in Pittsburgh and the Atlanta Daily World in Atlanta. And the headlines are the same. The people who are on the low socioeconomic status are getting hit the hardest with this deadly disease. And so I really love what the county exec said, is that if we come out of this not paying attention to the same issues, then shame on us. And I really see that as a part of our critical role, is to shed light to the inequities that this disease has really exposed, and continue to shed light to those inequities.
Thank you. Thank you so much. Ms. Floyd, Hiram shared some statistical information, which leads me to the question that I have for you. A couple of weeks ago, music mogul Sean P. Diddy Combs issued a social media state of emergency message to the Black community. He stated, and I quote, "We are in a life or death state of emergency. 1 out of every 10 Americans are Black. However, 1 out of 2 of the coronavirus fatalities are Black." How do those numbers compare to the narrative of Wayne County?
Well, they certainly do compare. It's clear that in Wayne County, with almost 15,000 cases and over 1,400 deaths in less than 2 months, we have a major problem here, particularly in the Black community. So as the most populated and diverse county in the entire state, many of whom are poor, we have a vested interest in protecting those marginalized populations and examining more why they've been impacted so hardly. I certainly want to thank Executive Evans for driving the effort in Wayne County to focus in on this issue. I want to say up front that although the trend of African Americans suffering at higher rates has been put to the forefront because of COVID, this is certainly not a new trend. This is not the first time we've seen this. I'm going to go ahead and go into the numbers. So I know this is not a stats lesson. We didn't tune in to go to school, but it's important to talk about the data because that really does drive the bigger picture. So African Americans make up about 14% of the state population. But we make up about 40% of the Wayne County population. So finding out we make up 50% of the cases and 58% of the deaths, it's very impactful. It shows that we clearly are suffering more than the majority. Also, we're dying at 3 times the rate than whites. So the picture is extremely clear that we have a major issue here. We see this with the hospital data. Even though, again, we make up 14%, 1/3 of those who are sick enough to go to the hospital are Black. So although there are some limitations in data, and I know we're going to talk about that through the course of this telehall, it is very clear that we are being hit a lot harder by this disease. And although we know people 65 and older make up the majority of those cases, I want to make it very clear that young people are not immune to this, so they have to play it safe and follow the same exact measures as everybody else. So also with the data, I always want to emphasize, these are numbers, but they're also real lives. So mothers, fathers, sisters, and brothers. So I hope this personal connection will allow us to take this really seriously. But yes, to answer your question, Sean Combs, his comments definitely hit it on the nose. Absolutely, he's correct.
Thank you. Mr. Executive, I want to come back to you. I want to start talking about the dollars and cents, the economics. Is there a way to determine what the estimate economic impact of COVID-19 will be on local Black business community? Is it safe to say it will be greater than the anticipated effect on any other communities?
Yeah, I think you can say that without a doubt. There's no question about it. The African-American businesses, small businesses, are small businesses. They're usually neighborhood business, and they are going to have a tough time bouncing back from this. One of the things that we tried to do in Wayne County in anticipation of that, I mean, nobody could anticipate the pandemic, but what we did understand was once it occurred, it would be much easier for the county to help to provide funds and create some atmosphere for those small businesses, basically because while the federal government may make dollars available, and they have made some, and I keep looking at the big companies they go to, so I don't know how that trickles down to us, but nonetheless, the bureaucracy in the county is much quicker to turn around than it is at the federal government and even the state government. And so we've created loan and grant programs that have already put money in the hands of some of these small businesses now. The small business, first of the month, the rent's due. You got no income coming in, but your bills are there. And so we have been making money available to sustain folks on the short end. It doesn't mean that the businesses will even survive. It means we're giving them a chance to, and we're praying that they will be able to survive. But the impact is devastating now. It will be devastating going back. I think, again, with African Americans, an awful lot of what we do is the service industry, whether it's haircuts or nail salons, or whether it's the barbershop, the hairdresser, service industry at hotels. All of those sorts of things, on the one hand, make us more susceptible to the personal contact of the spread of a virus, but it also puts us in a position where if people are timid about coming out, and I'm not saying people shouldn't be, because, we've got some way to go in my mind before we open back up. But understand, even when that happens, there will be a reluctance in our community to get that close to people on the short term. And that's also going to impact the ability of some of these small businesses to bounce back. I'm optimistic that they will. I got to tell you, I haven't had a haircut in 7 weeks. My wife's kind of helped me around the edges, so give me a play on that one. But the reality is, I've been cash apping him every 2 weeks like I was getting a haircut. For me, that's his livelihood. He needs that money to survive, and I can afford to give it to him and just look bad when I'm around the house for a little while.
Right. Good.
So I wanted to ask you, Hiram, we're still on economics.
Sure.
As an African-American business owner, speak to the impact that this has had on your business and how this will affect the Black economy recovery in Detroit as well as in Wayne County.
Can you guys hear me?
I can.
Yeah, I just in general, I think it's been devastating to all, to all of the businesses that are impacted, not just Black-owned businesses, but as it relates to Black-owned businesses, which are typically smaller businesses and typically consumer-facing businesses, it's absolutely devastating. If you, like the county executive spoke to, if you are a restaurant or a service industry, but you're shut down. You're shut down with no income coming in. So the only thing that you can do right now is to, eliminate your costs and apply for these emergency federal loans or grants. The information that I'm reading is that not many folks of color and especially small businesses are getting access to these grants or loans. So, it's going to be really interesting to see how people rebound when the restrictions are lifted. As the county exec said again, many of us are going to be very hesitant to just run out and go to a packed restaurant or go to a concert. This has been devastating, not only physically, but mentally. We haven't even begun to talk about the mental health issues that come from this. We're going to continue to isolate and continue to avoid crowds just because of the fear of catching the virus ourselves. But I would encourage all small business people to be very vigilant on this. This is quite a lesson to be learned. In my personal business at Real Times Media and the Michigan Chronicle, it's really forced us to innovate. I was mentioning earlier, we are forced to do things now that we should have been doing years ago. The use of technology, we can all see how much of an asset the proper use of technology can be. We're seeing restaurants provide curbside service and online delivery. So I would encourage small business people to really think outside of the box and to use this opportunity to reimagine their business. I tell my staff all the time, if we emerge from this crisis, the same business that entered this crisis, then we've lost a hell of an opportunity. Because this has shown us that you have to prepare for the unexpected. Now, that today doesn't help us make payroll. Tomorrow, it doesn't help a small business make their monthly equipment payments. But I think that for those who are in business, instead of kind of looking at this and all gloom and doom, we should be kind of in our lab trying to reimagine our businesses. And I will say, as it relates to the federal grants and loans, I would strongly encourage everyone to apply for the PPP loan as well as the economic injury loans with the federal government. I've heard a lot of business people say that, hey, I'm not going to apply just because I'm not going to get it. But if you're not in the game, you can't score. And so I have heard of many people who have gotten these loans. So I would absolutely apply for these loans. And, you know, when the government opens us all back up and we get back at it, we're going to have to be more vigilant in supporting Black-owned businesses. We talk about it all the time. You know, many of us promote it, but this has really shown us why it's so important that we spend our money with local Black businesses. It's so important that we support them.
Bishop Vann.
Yes, sir.
The question for you, the stimulus check, the $1,200 stimulus check that was guaranteed for every citizen in the United States. Considering the impact of the shutdown that we've experienced, what are your thoughts on its effectiveness?
Yeah, of course, it's going to have a very immediate yet very temporary impact, because in most instances, people have lost a lot more income than $1,200. And you would hope that everyone who does receive it would use it responsibly. However, of course, everything helps at this moment. And it's important that we are helping to share when we can. I just heard the executive, and I want to really thank him for this forum and this opportunity. But he just talked about how he blessed his barber. That's something that I've been doing without a haircut. That's something that I've been doing for the last 7 weeks. How important it is for us to stick together, to work together, as Hiram has said, to spend together, and to support one another in a time like this. What we really begin to understand is that even with God on our side, all we have is each other. And it's important for us to understand that, and it's important for us to come out of this. Next is now. We've been waiting for shifts and changes and that type of thing. Change comes anyhow, either by design or by default. It comes, of course, you know, you take change by the hand or else it takes you by the throat. And so change is here. It's now. Things are not going to go back the way that they did and should not. We should move forward. So that means that people are going to be more responsible, hopefully, in terms of their financial literacy, first of all, and then their financial awareness. So maybe they're using this money to spend on paying bills and lowering debt and putting themselves in a better position strategically from a financial standpoint. That would be my hope.
Thank you. Thank you.
So,
Dr. Floyd, let's get back
Yep,
to talking about the factors that have contributed to making this disease so deadly in the Black community. Black people are dying at a higher rate. And why is that? Can you explain that?
So there are a multitude of reasons. I'll just focus on a few here due to time constraints, but they're mostly social factors. We call those social determinants of health. So we found that the vast majority of people in the hospital with COVID have at least one underlying health condition. So whether it's high blood pressure, diabetes, heart disease, usually at least one, and sometimes you have comorbidities. So because we as Black people are more likely to suffer from those illnesses anyway, we're extra vulnerable to the disease in very large numbers. So the other factor I want to talk about is lack of access in the context of poverty. So when I say lack of access, I simply mean an absence or maybe a short supply of resources to fill your basic needs and live a dignified life. So in this context, again, we're talking about healthcare. So that includes health benefits and paid sick leave. So because Blacks are more likely to have lower wage jobs, which lack preventative medical care benefits, and without having paid sick leave, you have to go to work sometimes when you're sick or not. So what happens is you're more likely to become infected or infect someone else. Also, without that health coverage, people aren't seeking treatment until far later, which leaves you even more vulnerable. Sometimes at that point, it's just too late. And I always want to acknowledge the mistrust of the healthcare system. Here in this country, there is certainly a history of mistreating people of color as it pertains to seeking healthcare. So for that reason, a lot of people, they're not really a fan of going to those institutions and seeking care. So this overall paints a picture where we're extremely vulnerable to the disease. So also I want to acknowledge in those lower paying jobs, they're often in those essential critical infrastructure jobs that are still going on. Everyone does not have the privilege of staying at home. Everyone does not have the privilege of social distancing. So you have those jobs, whether you're a cashier or you drive a bus, or like they referenced before, getting your hair cut. It's a little rough over here, so I understand with the beautician. You can't do that from home. So it certainly leaves us a lot more vulnerable to the disease. So I want to always acknowledge in our messaging those essential workers that although they can't follow all the rules we have, including the 6 feet, to certainly do the best they can and wear that protective gear, gloves, masks, and certainly continue to wash your hands as much as possible. So those are just some of the reasons why we're suffering so much more than everybody else.
Thank you. So, Curtis, the question I have for you right now is in the Black community, there's been this stigma that says that we've been less responsible outside. We're outside playing basketball. We're doing things that violate the stay home safe, stay safe rule. What are your thoughts on this, and what are the impacts to the LGBT community?
I think it's easy for the public to look at factors, self-imposed factors, to find blame. And I decided a long time ago that I'm not going to play the blame game. As the doctor mentioned, there's a number of circumstances that has us engaged with the public and puts us at risk. But those risks have been occurring for many, many years before. We were always taught to wash our hands. We should always prevent sneezing in public and keeping a distance. I mean, there are some practices that community have had many years that we should just continue to implement. And so I know that it's easy to attack people. I come from a movement that was a part of that experience. When the HIV/AIDS epidemic hit, there was a target on the Blacks of gay people. Gay people are the people that are spreading this disease. And because people were looking at gay and people, stigmatizing gay and lesbian people, they didn't pay attention on the disease and how the disease could spread. There were very few people at the foresight that this was not a disease based upon a type of person, but a disease based upon a behavior. And so we missed an opportunity, and I would hate for us to miss this opportunity again and not focus on how the disease is transmitted and what we can do to prevent the disease from transmitting. Like many of you, LGBT Detroit is suffering. We operate the largest Black-led LGBT center in North America, right here in Detroit, something I'm very proud about. We have a campus. We saved our money, built coalitions, worked with foundations and donors to make sure that this institution is one to be very proud of. And right now it's empty. It's empty because my staff needs to be safe. And the people that come to us for services need to be safe. And so we have to make sure that we can do our part to stay alive during this period so that when we get on the other side, that those who are impacted by COVID, those who are isolated now, those who, again, have added discrimination to bear besides just being an African-American person, we have to be on the side so that we have services for them. Stigma is a horrible barrier. And because of stigma, people can't receive educational or direct services. And so I'm really concerned on what we can do to build coalitions. We have been good at that. The LGBT community have been good at that. That has to be strengthened even more. And I am very happy to be on a platform like this because we're all in this together. I'm a Detroit resident. I'm a Wayne County resident. I have family who's impacted with COVID. My dearest cousin has COVID. I have Black club members who are sick. And so I want to do my part as a member of this community to make sure that we're all safe.
Daniel, can I make a couple comments?
Absolutely.
Cut through here. The first one is, and I know when Dr. Floyd was talking about the African-American community and the disproportionate amount of underlying issues, whether it's diabetes or healthcare. So she didn't say it this way, but people often get twisted into thinking that's somehow inherently an issue with us. It's not an issue with us inherently. It's an issue with us because of, to a large extent, the healthcare system and the things she talked about earlier that caused the lack of a primary care physician. Most people in the African-American community go to the doctor within 3 miles of their house. A lot of that's a transportation issue. Doctor changes and moves. You wait till the next person moves in within 3 miles of your house. I mean, you may have a history of 20 primary care physicians. You know, those records aren't getting shared back and forth. So a lot of that issue is not inherent to being a person of color, but is inherent to the conditions that people of color suffer in this country. That's number one. The number two, the issues of social distancing and the blame game with respect to that. I mean, every community has had its oddballs that don't follow the rules and do what they do. But I've heard a whole lot about, in the African-American community, the dissing the rules and not dealing with them. Part of that is because we don't communicate well, and we act like communication is channel 247 and the free press, and that's not, in many communities, the message sender, first of all. But second of all, when you look at what's happened at the state capitol now twice, with people with both weapons and not social distancing and a number of other things, I'd be the last person in the world to have some condemnation for people of color cramped in an area who decide to get out of the house to avoid domestic violence or whatever other issues occur. And by the way, domestic violence is going through the roof. A number of other issues that come up as a result of people being confined. While I am the strongest advocate in the world for social distancing, and I think it's critically important, I am not an advocate for the pointing fingers as to who's doing what and why, especially when you see so blatantly in front of you people with machine guns standing on the state capitol right next to each other and no action taken, at least that I know of, in terms of violation of the executive orders. So I think we need to look at that in perspective.
Yeah. Bishop Vann, would you like to chime in on that?
Yes, I think that it's very important in a day and time like this for us to have good factual knowledge. That's why I'm glad that Hiram's on. I'm glad that
well, while we're having a few technical difficulties, what I would like to do is at this time I want to ask Dr. Floyd this particular question. Many concerns among the community is obtaining reliable information. Oftentimes, when people look for data associated with the impact of COVID-19 based upon race, there's a limitation of it, particularly when it comes to race. Could you explain why that is?
So certainly that's $1 million question in public health. So there are several impactful reasons data is either unavailable or really hard to obtain. One of which some people just don't think is important. They skip the box, they go to the next section. Whether it's malicious or not, and I think sometimes it is, sometimes it isn't, the outcome is the same. We end up without the information we need to make impactful data-driven decisions. So you have healthcare providers who aren't comfortable asking about race during the screening process because they don't want to be assumed to be racist, or some of those who are don't want to be found out to be racist. So that's something we need to certainly address. Also, there are about 7 boxes in particular on the COVID form. And on the COVID form, it actually is required, but there's an unknown box that people just go ahead and check. So that's led to a lot of incomplete data. And I do want to acknowledge there are patients or individuals seeking care who aren't comfortable self-reporting their data because of fear of discrimination. As I said earlier, this country, we have a strong history of that. And so I understand why people aren't comfortable as patients including that data. However, it's very important. It could determine allocation of funding. It can determine other things. We can discover exactly where discrimination occurs and who it occurs with. And I want to throw a few comments in there. The LGBTQ community, that is very much a community that is often overlooked. I believe DC is the only area that's actually including LGBTQ status on their COVID case report forms. And ironically, this is a census year, and there's no LGBTQ status on the census. So we have to wait a whole another 10 years to even begin to obtain that data. So that's 10 years of not acknowledging the community, and so resources may not be allocated properly. So it's a major issue, in particular in the Black community, where we're already being undercounted. So to address this here in Wayne County, Executive Evans gave the directive to go back and obtain that missing data. So once obtained, data can provide us with a lot more information as far as being data driven, as far as our decision making, seeing where people live who don't have this access to care and are not able to live quality lives as a result of it.
Okay.
So thank you for that question.
Thank you. I have a question from our viewing audience, and it is directed to you, Jennifer. It says, what can we do in our county health-wise to help ourselves to address some of the health factors that you've mentioned?
The biggest thing is seeking preventative care. The best way to manage those illnesses I discussed earlier is to determine if you have the illness earlier so you can manage it better, you have more time to receive treatment. To identify things earlier, the earlier the better. I can't stress that enough. However, I do want to always acknowledge it's not that easy. Everyone doesn't have healthcare coverage. To navigate the healthcare system, it's not the easiest thing. I have a doctorate, and when I'm looking at forms and trying to pick things out, it's not easy. So I want to always address that. Literacy is often an issue as well, and access. You can have the best health insurance, but like Executive Evans said, if there's no doctor around you and you don't have transportation, it's not true access. So that's definitely an issue that has to be worked on, not even just locally, but from a state and federal level. So I would say here, the best we can do is educate ourselves on health issues and try to seek care as soon as possible. And I don't mean once someone starts showing symptoms, but before that, getting an annual physical. Those things are very impactful.
Okay. Bishop Vann, are you there? Is the sound working?
Yes, I am. Can you hear me?
Got a problem right there. So I'd like to
Daniel, we can hear him.
I can hear him.
Hear Bishop Edgar Vann Baxter.
You can hear him?
Yeah, we could hear him.
Okay. All
yes,
right.
Can you hear me?
I'm going to ask you this question, Bishop. Let me run this by you. In your book, I Did It to Myself, True Confessions of an Overachiever, you state, when the curtain fell, a brand new learning process for me began. A brand new reassessment of life began. I experienced a paradigmatic shift in how I viewed who I am and what I do. The question that I have for you based upon that statement is there something that we can learn from this to make us a better community? And if so, what is it?
Well, I would think that the principal thing here is, the Bible speaks of wisdom being the principal thing. And I think in this crisis, wisdom is so necessary. But I also believe, as I've heard the realities that Dr. Floyd has explicated, I think it's important for us to understand that there are health disparities in our community, but there are also health responsibilities in our community. And I would encourage all of us, and I think that many of us, including myself, can do better. But that is being more cognizant of the health issues that many times exacerbate these kinds of things when they come to us. This crisis, as she has said, is exacerbated by those kinds of factors, chronic disease, etc., that already exist in our community. And I think that in all of the different spheres that are represented on this particular webinar, whether it's the outreach that LGBT Detroit does, or the press that Hiram Jackson does, or the medical community with Dr. Floyd, or most especially our Wayne County executive in his office, as you're doing today, it really helps us all to unite around the same message, understanding and knowing that we have a commonality among us, that we all can do better in the level of our health, eliminating stress, and being dignified, and of course being reasonable with one another.
Thank you, Bishop. So Hiram, tell me, what is the biggest challenge as a publisher that you're experiencing at this particular time in the season of COVID-19?
Sure. Well, let me say, I want to thank our county exec, Warren Evans, for hosting us today. I think in the midst of this crisis, we really need trusted voices. There's so many messages out there that are coming from so many people, so much misinformation on the internet. Doing something like this, having our leaders stand up and offer platforms with facts is so important. And I'm really happy to see the type of guests that you have. Before I answer your question, I just want to go back 2 seconds and say that I've just been blown away by how much light has been shown on inequities that exist in our community. And I mentioned this earlier, but there are some things that I think that we really need to work on coming out of this. One is there is a serious technology divide all over this country in urban communities. You talk about remote learning and learning from home. You know, many Black kids live in areas where there's no broadband, there's no fiber optics, and they don't have access to Wi-Fi in the house. So they're at a serious disadvantage. That's one thing. The other piece is, most of us, many of us in the Black community, kind of piggybacking on what Dr. Floyd said, we use the emergency room as our primary care physician. We need our healthcare leaders, and this is something, county exec, that I think is really important. We have a lot of leadership, Black leadership in healthcare today in our city. We need to talk about why it's so important for Black people to have a primary care physician and get a physical once a year, especially Black men. I think that generally speaking, Black people have a lack of trust in government. Dr. Floyd talked about our lack of trust in the healthcare arena, but the truth is we have a lack of care with government. And I think that all of these factors have played into us being disproportionately hit. But my question is, we've been disproportionately hit with the pain. Are we going to get a disproportionate amount of the benefit coming out of this? And so many of us who are leaders in the Black community, this is an opportunity for us to compare notes and watch what happens coming out of this. Let's take our notes, let's compare our notes, and coming out of this, let's share our resources. Black people control almost all of the top elected positions in Wayne County, almost many of them, judges, county positions, city council. And I believe that we should have an African American leadership summit to address healthcare inequities, to address the technology divide. And I was pleased to see what DTE and some other corporate folks did today with the commitment to raise $23 million. There is a serious issue with our elderly. We got a huge problem with our nursing homes. My mother's 90 years old. I haven't seen her in a month. She is in a assisted care facility. There's a lack of training. There's shortage of personnel in these facilities. So this crisis has shown us where the problems are, and we always knew it. But now it's on us if we don't come together and start to do something collectively about these issues. Now, you asked me about being a publisher. I'm really concerned about, as a people, how we come out of this. I think we have the resources, we have the knowledge, and we have the power. The question is, do we have the political will to work together, to document these things, and to set metrics and demand that these situations improve.
Okay, thank you. I have a question from a Stacy Smith, and it is to the CEO. The question is as we move forward, the summer months are coming and approaching fast. Will the summer months and the heat help us overcome the challenges of COVID-19? Does higher temperatures actually kill the disease?
I'm not the one to answer that, but I will tell you that what I have heard and understand is it does not. The heat is not going to do it. We're going to have to be socially responsible distancing, I think, for a long, long time.
Very long time.
And what I'm trying to do is up the testing capacity so that when we do get back to work in whatever new reality we're working in, we can give employees assurance that the people that they are working next to are not COVID positive, and that, you know, along with the spacing and other related issues. No, I don't think so. I think people are being overly optimistic. Some folks, I think, and you know, and the science will determine it for us. And I understand we can't go without reopening forever. But I also understand in my heart and soul that people's health is far more important than anything else. And so we got to balance this thing, you know, correctly. A couple of things, if I could cheat for a minute here, because I know we don't have an awful lot of time. But Hiram talked about a couple of things, not the least of which is a group of people getting together to try to help map out where we go from here to try to deal with some of the inequities. And the reality is these groups, I laugh all the time at all of these task forces that get together and talk about stuff, and I've never seen anything happen with any of them. I think the first part is the part that says, let's map out a strategy and whatever, and then understand there's power on this panel and there's power throughout the city of Detroit. All we have to do is join arms and force it to occur. And that's important. I mean, everything from hospital care to whatever. I'm looking now at hospitals that are laying off people like crazy because they can no longer do elective surgery or some other related things. Well, I get it, but some of these hospitals are not for-profit hospitals. They are nonprofit hospitals, and as a nonprofit hospital, they get all kinds of tax breaks that they wouldn't get if they're for profit. So those that are closing down right in the middle of a pandemic in hospitals that had nothing but COVID patients, I think the Attorney General and others need to take a look at whether that nonprofit status should apply to those hospitals. I mean, I think the time for some game playing is over, and I think we need to look at those things. We need to look at the level of care, how we get physicians of color and others to work together to try to get a connection between people who don't have primary care physicians and doctors out there who understand the need for that to occur. We need to work with hospitals to make sure that the capacity is you know, what it ought to be. And I mean, I just think that's really important. And another thing we got to think about as a part of this is there are going to be an awful lot of people who are going to be sick when this is over, not because of COVID-19, but because they haven't been continuing their health care issues because of COVID-19. So there are a lot of people out there who have been out of medicine, have not been able to see their doctor in the way they would have for, you know, 6 or 7 weeks. And when this is over, there will be some unfortunate payment for that inability to do that. It's not the patient's fault, but it's a reality that I think we have to deal with. I know we only got a couple of minutes, Daniel, so I'm giving it back to you.
Okay, so I want to allow for Jennifer to respond to that heat question in terms of whether or not COVID-19 dies in heat. And I want you to be brief because I want to give everybody an opportunity to give a closing response to a question that I would like to pose to the entire panel.
I got you. there's no proof that warmer months were going to curb this. That started from some myth that because the case rates were so low in Africa at one point, that when it warms up here, there's no proof, no scientific proof of that. Absolutely. And we just hope that people continue these social distancing and these measures so we don't undo all the progress we've made.
All right. Thank you. So my final question for the panel is 9/11 changed the world, changed the way that we travel. When you ride on airplanes, you have to go through all forms of security. The question that I have for each of you, beginning with Hiram, is how do we get through this? And what does a post-COVID-19 world look like in Wayne County?
Wow. First of all, let me just say to all of your listeners and viewers, fill out your census forms. Fill out your census forms because it helps with funding and dealing with things like healthcare and community service projects. So just make sure you fill out your census forms in the midst of this crisis. We don't want to forget that. I think that what we're doing here is a classic example of what a post-COVID-19 scenario is. I mean, we're communicating with our local community, but we're also communicating around the world. I believe that, my message has been not only to my employees, but my business partners, but to other colleagues, is that in the midst of this tragedy, in the midst of this sadness and death, there are opportunities. I want people to use this opportunity to reevaluate where they are in their professional careers, maybe with their family situations, and take this opportunity to pivot and reset your goals and objectives. And I really think that while it's very easy to get caught up in the doom and gloom of COVID-19, and it's hard not to, I really think that many people will use this opportunity to say, you know what, you only live once, and I want to be happy, and I want to be focused on the things that are good for me and my family. So really think about those kinds of things, whether it be write a book or change your career or spend more time with your family. As it relates to Wayne County, I mentioned earlier, I really think that we need to be more politically conscious. I think we need to be supportive of our Black leadership, people like Bishop Vann and Warren Evans, who are out here on the front line fighting for these issues already. They're already fighting for these issues. And now this means that we have to be more supportive of the work that they're doing so that they're not out there by themselves.
Thank you. Curtis.
The LGBT community has benefited from coalition building. It took the for-profit and nonprofit foundations, donors, individuals. It took a whole lot of people to organize around the HIV epidemic. It took people who dared to come out to disclose that they were infected with the virus. Those people had family members who lost loved ones with the virus. Those who organized around people that were most impacted with the virus, to say that we are going to eradicate HIV and AIDS. And so combined focus to get rid of the virus got us again to the point where drug therapies were available so that people who have survived, lucky enough, could live longer and healthier lives. It was the coalitions that got together. And so I like to really talk about intentional gatherings. We may not necessarily see the same things. We may not be eye to eye on a number of things, but I applaud those people that were committed to the well-being of a number of people I know. I don't know the people at the research centers. I don't know all the donors that gave. I don't know all of the leadership that sacrificed their political power to make sure that people like me are safe. So there is a roadmap. There's a roadmap to get past COVID-19. I want us to look at that map and see what were the successes that this one group of people did to combat another virus that occurred not that long ago, and see what we can do to overcome this. I'm living a nightmare. I never thought as a Gen X I would see this again. But the one thing that I can rest upon is that I am surrounded about people who have witnessed the devastation caused by a virus. And so it isn't unusual for people like me, both Black and gay, to organize around trauma, but to be focused on COVID-19 and to stay focused on that and not to lean back and say, okay, we're going to be fine. No, to stay focused on it will definitely help how we move forward. Because again, if behavior is going to be a big change in how we're going to prevent to be infected by COVID, we have to enforce what that new behavior is, right? That's what the gay and lesbian people did. They had to change behavior to reduce HIV infection. We have to do the same as Black people with COVID. And
Thank you, Curtis. I appreciate that. We've run out of time, and I do want to give the last closing remark to the CEO. Please, Mr. Executive, what are your thoughts on that?
Well, my thoughts are, again, I appreciate everybody here on the panel. I wish we hadn't had a few technical difficulties so we could have run it a little smoother, but you know, technology is what it is. It's not a personal fault. And I think we need to think about doing this again and expanding how we do it, tailor it. I mean, we have a whole world ahead of re-entering back into the new normal, and that's not going to be easy. And I think everybody here has some expertise and some guidance in terms of how we do that as we go forward. So I know as an elected official, I'm going to stay on these stats with respect to who's dying and hospital issues and concerns. I'm always going to be fighting for small businesses and trying to hear what people are saying. There was one brief question that I saw scrolled on the side, and somebody was asking about property taxes and you know, during this period of time and foreclosures. And I just want to say that foreclosures have been suspended for this year period. I'm not sure what the timeline will be on property taxes, but I think certainly if you didn't get them in day one, you're not going to have to worry about that. But clearly, I think the Treasurer's done a good job with discontinuing foreclosures for this year. At least that's one issue that people wouldn't have to deal with. Thank you very much, Dan.
All right, thank you. And listen, I just want to thank each of our guests for taking out this time to share your valuable insight as it pertains to the season that we're in at this particular time. I'd also like to thank the CEO for giving us this opportunity and setting the stage and the platform that we might be able to share information to our listening audience. And to our listening audience, thank you so much for your attention. Thank you so much for your time. Thank you so much for your tolerance as we went through some technical difficulties. But I assure you, the next time that we come on, it'll be just as clear as water. Thank you so much. And until the next time, stay safe and stay strong.
Absolutely. Thank you.
Thank you.
Great.